the coding.
Hello and welcome to the Auditing Antics podcast. So, Michelle, after last week's episode, we had a lot of great feedback. A lot of people resonated with what we were talking about and the fact that outside of forums, like Reddit, people are not really wanting to have these conversations. So today we're going to go a step further and we're going to talk about what we're seeing here and now with the reality of AI. And this is something, if I look back over the past year and even my own thoughts and what I've spoken on, it's happening much faster than I thought it would. If we think about the tech side of the industry, everybody's out there trying to be the first person to implement this on a large scale or a niche area, things like that. And it's just exploding everywhere.
I mean,
Go ahead.
it's definitely an issue. I think it's something that both you and I have had some experiences with. I know recently you've worked a project where you're kind of validating some of that work of AI assisted coding. And I think people think it's their answer to the money problem. Like, let's just say it for what it is. It's a way to quote unquote reduce the cost of production. And is it really, or are you going to end up paying for it somewhere else? But the reality is nobody outside of compliance thinks about that. They look at numbers and they don't care. Administration, often when you sit down at those conversations, they just care about the numbers, or they don't even include compliance in these
Yeah.
decisions whatsoever.
Well, a lot of times that's what happens because, and I've been in this situation myself, a lot of times compliance isn't included because maybe they already know what they're going to say and they don't want to hear it.
Mm-hmm.
So the gist of the story, the opening here, is that it's here to stay, and we're going to see this grow even more rapidly, I think, and more than we've seen in our industry, meaning from the perspective, especially of coders. It's already happened before with billing. And I don't think there's any end in sight. So we have to think about what the future looks like due to that. And one of the things that I noticed that a lot of people that talk about AI are always talking about how there has to be a human in the loop. And 100% that's my viewpoint. Anything that I've had involvement in from a development with my consulting work and working directly with the teams that are building these types of products, what I've seen is that it can't bring it, meaning the system, AI can't do something full circle when there's any kind of critical thinking that's needed and any kind of subjectivity that's involved. But the problem that we have now is organizations are looking at building these expensive AI systems, and then they say, well, our human in the loop is going to be somebody offshore. So we still have quality, we still have somebody who's CPC certified, they're offshore, and it's going to be just as great. And this is something that's newer that I'm seeing with my clients and experiencing. Even after last week's episode, some people have reached out and they're very frustrated because their jobs are completely gone. The organization they were in went with a company that's structured like this. They completely dismantled the entire compliance, revenue departments, coding departments, only left a handful of people. Other people are seeing where an EMR system that has a practice management system built into it is now automating things to a point. So practice administrators are saying, oh, guess what? Now we don't need a coder as long. It's the provider's responsibility. They can go in and do it, and they can work with AI. And then the providers are freaking out, especially surgeons. Like, I don't know, not everybody paid attention to the coding rules and everything that goes into it if that wasn't a part of their responsibility to begin with.
No.
So we're seeing this being implemented in different ways, whether it's external and people are completely outsourcing, but also keep in mind we still have all of the systems we work with every day that are trying to implement AI as well. So there's
Mhm.
different messages that are being sent depending on the way your organization is seeing that being integrated into your workflow.
Yeah. One thing that this makes me think of is when we saw more of a shift from 100% coding to the providers becoming the coders, because that wasn't
Mhm.
always the case. But then we had the development of these EHRs and things with different tools to assist the providers with coding. And one thing that I think we're going to run into with the AI is let's just be blunt and honest. People get lazy. You get a claim with a code in front of you and you're like, "Okay, I'm just going to skim this and send it on." Why do they think it's going to be any different?
Mhm.
They're, if anything, they're going to have more faith in what the stinking AI has put in front of you. But what happens when you have that documentation where the provider isn't using those key phrases in their note, and we're actually having to look at what the patient's presenting with and what the provider's doing as the work of the encounter, and the verbiage that they're using to determine that this is not a well-controlled chronic condition, because not all providers are going to sit out there and say uncontrolled hypertension. They're going
Mhm.
to maybe paint you a picture in a different way. So it,
Well, and that's really the problem that's going to exist because there's always going to be that quality concern
yeah.
there. But then I've also heard from different people that their leadership is of the mindset that if they get caught in the future, we still think that the error rate is smaller than if it was fully human based. So the risk is still minimized. So we're going to go with this. And, one of the things that I think about, and this kind of goes towards what people should be looking for in the future, especially if you're in a coding position now or you're looking to get into this industry, is that you're going to have to be more aware of what's going on from the analytical side.
Hmm.
And one thing that I notice when I go in and audit, when I know that there's this AI process in there, is that I'm still seeing compliance trends that are that are concerning. And the trends are happening in a way that if they have an external audit done, they have quite a bit of exposure. It's not going to be caught just from the claims data that's going out. These are things that are going to expose them during those external audits, which we know the payers are also ramping up on.
Hmm.
So that's a concern that I have because, yes, AI may be able to go in and depending on how it's trained and built, and remember, it's an ongoing process. So, like you were saying, Michelle, with the different words, they're just going to continue to add to that library of what that system's pulling out of.
Hmm.
So, eventually, those different things are going to improve, but we're still going to have these issues where for example, I've worked with organizations where some of the physician and APP providers' response to AI and what's been trying to be forced on them is to try to game the system and get around it. That's resulted in worse documentation that we had
Yeah.
previously. So we have it coming in from the documentation side with AI scribing. We have it coming in from the coding side, the billing side, billing companies looking to automate these things. And at the end of the day, I think the good part about this coming in is that it's bringing automation. We don't need manual nonsense that's happening.
No.
I still remember back when I started in coding, I had to have paper super bills, paper super bills. So when I would go and help somebody, if I was filling in for someone or helping with overflow, I would have to go and either work with them or pick up a folder of all of the papers that we had to code right on our sheet thing and then manually put it into the system or make our corrections or whatever.
Hmm.
So even that's come a long way. And when you think about that process, yes, moving forward
Yeah.
is positive in that way. But the problem here is really the component where they're trying to pair this with cheap labor for offshore work. And I'm sorry, but AI isn't going to bring it as far as we need it to without somebody who has an in-depth understanding of what's taking place. And I've even seen this implemented in some companies where, for example, they have that shift, but then they keep, for let's say, 5 onshore staff who really know what they're doing. They know compliance, they know the regulations, but then they shift all the burden to those 5 people saying, oh, you've got to correct it, you let it go through, but we have a sloppy process to begin with. So
Mhm.
we're going to see a lot of breakdowns, but it doesn't change the fact that it's happening. It doesn't matter what we think about it. It doesn't matter what people
Mhm.
listening think about it. It's here, it's happening, and we've got to address what you can do individually to prepare for your future, knowing that this is what it's going to look like. And one last thing I'll say, I've had many conversations with people that have worked with AI in different ways. They're in companies that are either developing different structures, programs, workflows, or they are using products that have been made external to them. And one thing that I hear over and over again is that people feel like they're essentially working themselves out of a job
Mhm.
because right now, for example, people will want an auditor to work with an AI company to strengthen the AI. And we can't, I'm not going to talk about that all day, but it's a real concern. It doesn't mean in every organization it's going away. It doesn't mean coding is no longer going to exist. But on a large scale, this is going to have to shift. It has to look different.
Yeah, and it would be best to keep that in mind and start preparing yourself to be that person who is chosen to stay behind. Just from a position of still being employed at a minimum, you're going to have to start paying attention to the skills that you have and start honing in on those.
Hmm.
That would make you beneficial to oversee the use of AI.
Right. Well, and sometimes people ask, okay, what exactly is that going to look like? And from my perspective, I think it's going to look more like auditing. I don't know that we're going to necessarily have like the scale of everything is what concerns me as well, because with as much as AI can automate as close as it can get to an accuracy, there are going to be a lot of production coding positions that are just no longer going to exist. It's going to completely depend on the size of the organization, the budget that they have. If we think about large hospital facilities, university based hospitals, those types of companies are typically already outsourcing their coding. So for people that are working through those avenues, chances are that's going to be automated by AI by those companies. Then, if you think about a hospital system that hires directly, they're going to be getting, the sales pitch and everything else coming in about how, yes, there's accuracy. You have budget problems in your facility. We can, help you with your budget for all of these reasons. So I think at a base level, what people need to start looking at is the skills that are needed for somebody who would be looking at going into auditing, for example, auditing
Mhm.
in education.
Yeah.
And big ones that stand out for me there are definitely being fluent and able to navigate the different regulations and policies that we follow. We've talked about it before. There's still so many people that don't even know how to navigate CMS.
Yeah.
And they'll give a source for something they're talking about, and it's not an official source that can be used. So it's no longer the time to be asking your leadership, oh, I need to make this decision. What way should I make it? The question is, do you go to that leadership with an answer because you've researched, not taken 8 hours to research it, but you've
Mhm.
researched it, you have a good understanding, and you need that validation? Or are you using them as a crutch where you're just asking and not even doing any of the process of looking into it? Michelle, are there some other areas you can think of just from an auditor's perspective that are really important that we find sometimes are not just easily applied by people that have not been in that position before?
Number one is communicating. Start communicating like an auditor. And a lot of that goes hand in hand with what you've just said. You need to learn to be able to articulate yourself through writing, through speech, and you
Mhm.
need to be confident in that. You need to know your information and you need to have your source. You need to know your source in and out so that when you are going to leadership to say, this is an issue, we are exposing ourselves to a compliance risk, you can say, here, and here is why, and these are the consequences if we do that. If you cannot communicate in a strong and effective manner, then you're going to be lacking in their
Mhm.
eyes. That's going to be a tough one to sell.
Right, right. Well, and I think too, if you think about what the workflow is largely going to look like, we'll have the first chart review done by AI, and then probably for the majority of these situations, offshore looking over it afterwards. And then where I see US based coding and billing professionals being located is in these facilities and organizations is with really the oversight. So
Hmm.
maybe you'll have a position that's required to be looking over the quality of what's happening, the auditing process. So instead of going in and auditing the internal coders in the organization, they're auditing AI mixed with whoever else is working it. Same thing from the data analytics side. I mentioned that a little bit, and there has to be an understanding about what it looks like throughout the entire revenue cycle process. So, what an encounter looks like. What I mean by that is if you're focusing just on coding, you may not know what different trends and different
Hmm.
standards look like on the back end when we look at the work of accounts receivable staff. I think to some extent they're definitely going to be affected as well.
Yeah.
And, having that understanding of knowing the beginning to the end of that revenue cycle is going to make a difference when you're in place to, spot where there may be deficiencies. And right now, I will say there's a lot of great programs out there that help with monitoring of potential issues. So having the ability to look at, the grafting charts and say, okay, this looks like an area of risk, that looks like an area
Hmm.
of risk. Let's pull a sample, let's take a look, go from there.
Or
Those
even
are the
what
types
are
of
the
things. Go ahead.
or even what are the standards, and now that we've switched, where do we see things not coming through how they're supposed
Hmm.
to, a dip in revenue where this wouldn't be expected, like something could
Yeah.
be missed, like know your numbers in and out.
Yes. Yeah. And, another piece of that as well is being comfortable with what the payers are doing or what OIG is doing in the industry. We've talked before. I know I've done some different webinars as well where I've talked a lot about being familiar with your Max website so you understand what they're doing from a TPE perspective with Target, Probe, and Educate. The OIG has their audit work plan out there. There's a lot of these different areas you can look to externally to start determining where your potential areas of risk are, and then you can apply that to the data you're looking at internally to see if there are outliers in the areas or just in general. Right now, psychotherapy with an E&M service is being targeted. If you render those services in your organization, you should be auditing those services. So that type of information is really going to be necessary. And Michelle, one of the things that I really can't wrap my head around it. I can't see it yet. One thing that I'm concerned about is we're going to end up with this gap where we have people who wanted to get into the industry, they get their certifications, but then they don't have the ability. They're not in a production coding position. Maybe some of AR has gone away as well. So at some point, the question's got to be, what do we do with that line that's going to end up in the sand where we've got this part of the industry on this side that has experience. They can go in, do more advanced type work. But then we have another part of the industry that is brand new. Like, how do you get into an industry that's going to require you to have more of an expertise? And I just don't
Yeah.
know how that's going to look.
I don't either. And this might get me in trouble for saying, but another certification is not going to be the answer to it.
Well, and that's why we talked about it last year,
Yeah,
because
last week, you mean?
or I'm maybe AI should take over for me on this
No, no,
podcast.
no. Okay, this is how I'm going to look at AI from now on. It's gonna be like that new intern that's really eager to impress. They're gonna be really fast and they're gonna get the work done, but you're gonna need to check everything because there is gonna be like that wonky thing in there. You know, you know
Mhm,
what I mean? Like that's what AI is. AI is kind of like replacing those newly certified
mhm.
roles.
Right,
It,
right.
but you know what? I was newly certified and nobody was checking anything I was doing. So, hey, maybe it's not that big of a deal.
Well, that's why last week, not year, we talked about the credentials, because it's important for people to understand the answer isn't to buy more education, buy more certifications. For some people, that is going to be the
Yes,
answer. But like we
certifications
talked
have their
about,
place.
yes, like
They
we talked
have their
about
place and
last
benefit.
week, you have to have the experience behind it. So if you're
Yeah,
new and you're wanting to get in the industry, getting your, whichever credential you start with, and then just adding a string of them on to take more courses and get more certifications, that's not going to just jumpstart you in the industry either. It never has before, and it's not going to happen going forward. But realistically, I think that's part of what the organizations, what the planning needs to look like. And my fear is that these things are going to just be flipped and happening so quickly that, like you said in the very beginning, compliance may not even have a seat at the table that's making the decision. And then afterwards, they'll be told, okay, we're dismantling. You can pick 4 people. And what's your plan going forward? So
good luck.
it's, yeah, yeah.
The
It's,
Hunger Games of coding.
yeah. So as you can see, Michelle and I have a lot of doubts around
I do.
just unmonitored production. We'll call it that. Unmonitored production is going to be extremely questionable. But the
Hmm.
answer is not
Even
going to be up to us.
and okay, so clarify for me when you say unmonitored production, you mean monitoring of the people who are monitoring AI, correct?
Yes.
Because I
Yes.
do not consider what you described AI with offshore verification to be monitored.
That's not monitored. And
No.
that's why the workflow some organizations have implemented is not working out for them, and they're still losing revenue,
Yeah.
because depending on the size of the organization, you have all of these charges that are missed, all of this undercoding that's happening. You're not able to pay attention to trends like you should be. And in that situation, you can have somebody go in and take a look, but at what level are you able to get a pulse on what will happen, in an external audit? And I think that that's some of what's going to have to start taking place as well for people to see and understand, is that they're going to have to go through the process of external audits and feel that pain, feel the money, and see if they would have made a different decision.
Yeah.
Now, one
Maybe
last
that's
thing.
maybe
Go ahead.
that's something to consider in these skills that you're
Yes.
acquiring is the ability to show them how much money they are at potential of losing because money speaks. Like
Hmm.
if you're like, hey, here's port $1.8 million, we can't recover because AI missed it. You know, I
Past timely filing, all of those
yep,
things. Yeah.
yep.
Yeah. And, largely, I just want to end on this as well. It's known that when the developers and companies are coming out with these different programs, and they're building these things on their side, it's known that it doesn't automatically have monitoring built into it. You know, I
Mhm.
have friends in the industry. I've had Dr. Kush Singh on here. He's doing a lot of work with AI, a lot of work with development. And we've had a conversation before about how this is going to be in place. You know, as I'm working on this and developing it, I'm building a tool for somebody to use, but that still has to be overseen. So think about it in the way that we use our EMR systems and the practice management systems. Those don't self-regulate on their own. We still have to go in and pay attention to what's happening, how providers are using it, all of the variables that come into play. That's going to exist, and that's really where people need to look to position themselves for the future of this industry.
Mhm. I agree.
All right. Well, we will stop here. And, you know, I know we've had a couple episodes of what people may be looking at as doom and gloom, but it really
Dun, dun,
has been
dun.
something that's been on my mind lately as I continue to see people pushing forward, you know, in some instances getting their hope up. And it's frustrating to me that yes, there's companies out there that still need to sell their products, all of these things, but I also see some of those companies not being realistic with where the industry's headed to try to
Yeah.
still continue to sell. And we just need to think about what's best for us. We've said it over and over again. It's not one answer. Michelle and I don't even have the same path, the same answer for ourselves. Everybody has to look at this individually, but do your research and be strategic with what you're doing in your future, towards your
Mhm.
future. All right. Well, we will see you all back next week.